The health system challenges we have in the Horn of Africa, most of these areas are post-conflict, and most of the facilities have been destroyed. People have migrated out of the locations where we are reaching now. There is no facility. In some of the areas you have a large community with no access to basic health services, no facility, nothing. So it's we're in some of the areas we're starting from scratch. In some of the areas we have constructed facilities, but they have been run down for decades, and they are not staffed with trained health worker. So we have all of these challenges. There is no supply chain mechanism to reach them with the necessary supplies like essential medicine and other logistics that they need to deliver the service. Health workers is not only maintaining a new supply of health workers. It's all in all, like, people have migrated from those areas. So the brain drain is an issue in that area, as well as quality of services that are provided by people who are not getting in-service training is a challenge, because in terms of technologies of the health service, it's changing from time to time, but people are not getting an updated kind of training to maintain and to improve the quality of the services. So we have all these problems. And in some of the areas like Somaliland, the government doesn't have the revenue to support salaries, regular salaries of the health workers. So in what we do, like in some of our programs in Somaliland, we are paying salaries and salary top-ups to the health worker, and that is a huge burden on our programs. The reasons for health workers shortage in these health services includes, first of all, there is no regular supply of people, because you need people retire, people migrate out, people get sick, and like any other section of the community, the health workers are vulnerable to anything in these communities. So we need supplies. And in some of these remotest areas, people are not happy to go and serve the communities, because there is no sort of compensation for people who are going to the hardship, remotest, basic infrastructure areas. At the same time, if they are assigned for a short while, they have to leave the areas because they don't have most of these facilities for them. And at the same time, we have huge brain drain from especially Kenya and Ethiopia. And Ethiopia would be the top, actually, where people are going outside of the country for better pasture. And
when you say about the brain drain, where are those people normally migrating to?
Basically to the Western, and the US is, I think, the top consumer of this brain drain from Ethiopia. Qualified health workers are migrating out of the country to the US. That is a major destination. And recently, probably the last 5 years, people are going to Botswana, South Africa, where they get a better pay and benefits. So that has been the case for Ethiopia in particular.
And what would you say is the impact of this health worker shortage?
It has a direct impact, because if you don't have the qualified health worker, having the facility there doesn't mean anything. It's not any different than any other construction. So you need to maintain that. You need to have a qualified health worker and supplies. So without the health worker, there is nothing to be done there.
And do you have any thoughts about what action those countries who recruit health workers, so countries in the West, in Europe, the USA, as you mentioned, what should they be doing?
Yeah, I think I see it like an option for the health workers who are migrating out. But in a sense, the consumers of this brain drain should be supporting the governments of these countries which are developing in a way that they can replace, staff their facilities. In a way, they can help in the training. They can create some way of paying the revenue that was invested on training the people, not necessarily stopping the migration. That may be a bit difficult to handle, but helping back in some way to these countries would be something meaningful to me.